Hi, everyone. Welcome to another episode of the Healthy, Wealthy, and Smart podcast. My name is Stephanie Weyrauch, and I'm going to be your host today. And today I'm joined by Kristin Revere, who is the owner, founder, and CEO of Gold Coast Doula. And today, what we're going to be talking about is how can doulas be helpful as a member of the interdisciplinary team? So, Kristin, why don't you just tell us a little bit about yourself, about your business, and how you came to be where you are today?
Thanks for having me, Stephanie. So, I started Gold Coast Doulas in 2015, and at the time, I had been a solo birth doula with my own practice, but wanted to support more families than I was able to as an individual. And so, when Gold Coast launched, we had four doulas and a placenta encapsulator at the time, and a lactation consultant with us. And the team is now 27 contractors total between lactation consultants, sleep consultants, educators, birth doulas, postpartum doulas, newborn care specialists. We try to be the non-medical full service birth and baby agency in West Michigan, as well as we do cover Northern and Southwest Michigan for overnight newborn care.
Well, as somebody who has a 14-month-old and a 3.5-year-old, when you say like a sleep specialist, it's like, oh my goodness, it is a full encompassing way to take care of your newborn, especially as a mom. Uh, Tell us a little bit more about doulas. What are doulas? And how did you get into being a doula?
Great question. I feel like birth doulas are more known than the other types of doulas. And I co authored a book, Supported Your Guide to Birth and Baby, that discusses all of the different types of doulas in the book. And so, birth doulas, again, are non medical support persons. And we begin working with our clients upon hire. So that could be 12 weeks, it could be 40 weeks, depending on the doula. And we have visits throughout pregnancy to go over how they want to be supported, give resources in the community, like physical therapists are one of our favorite referrals. And we support them emotionally during pregnancy. And then now every doula is a bit different. Some have specialties, they may only attend a home birth. But at Gold Coast, we support all types of different births and locations. So if a client's delivering at a hospital, at home, at a birth center, medicated, unmedicated, planned surgical, at Gold Coast, we support all types of birthing situations, but some doulas have a specialty or a primary focus area. And then we are there for the labor and also have a follow up visit after baby is born. And at Gold Coast, that's within the first 2 weeks. So they're not seeing their provider many times until the 6 week appointment. So we're able to process a birth with them, give them resources in the community like pelvic floor physical therapy. And we certainly are there to, just be able to support them with whether it's baby 1 or 5. There are often newborn questions or feeding questions that we're able to answer in that follow up visit. And then, as I mentioned earlier, Gold Coast also loves providing day and overnight postpartum care. And again, similar to birth doulas, postpartum doulas may have a specialty, or depending on the training that a doula goes through and their focus, it may be primarily recovery support for the mother and household tasks, sibling care, and may not be as newborn focused. At Gold Coast, many of us are trained by Pro Doula, which also has an infant care component. And then I'm also a newborn care specialist. We have several newborn care specialists on our team where that focus is primarily on the baby. And that could involve 24/7 care, overnight care, and so on. So it could vary from doula to doula on what is provided, but generally, that would be supporting feeding, and also, household tasks and recovery support resources and referrals in the community. We can accompany our clients to a pediatrician appointment or a breastfeeding group. We can certainly allow them to rest or take a shower. And then overnight is focused on um, allowing our families to get rest. And at Gold Coast, we work through the first year. So some of our families don't bring us on until they're returning to work or until their partner returns to work. And they may have a lot of family support initially. And, we can help for one night or 7 nights a week for months at a time.
I had a doula for my first birth, and that was really, really helpful because I ended up having to have a planned C-section because my daughter was breech. And some of the things that I would have never even asked the surgeon for, my doula was able to recommend, like the clear drapes and, the insistence of immediate chest to chest. Like there were just things that I had never really even thought about as a new parent that was really helpful to have. And then, I hadn't really heard of postpartum doulas at the time, but one of my friends is a postpartum doula. And the thought of having somebody there to cook your meals, give you well balanced meals, clean your house, take care of your baby so that you can have a break. I mean, if there's anything we know about maternal care, it's that the support of the mother afterwards is one of the most important aspects of it. Can you maybe give us a little bit of a brief history of how the role of a doula has evolved over time and how their relationship with the medical community has changed over the years?
Sure. So doulas always existed, they just weren't paid positions. And certainly in villages and tribal communities, there is that family of support and women supporting other women through labor, through early parenting. And I've had various trainings in doula work in other cultures, in like Malaysian culture, the way that they care for women and the first 40 days in many cultures, like the Chinese culture, women are cared for by their community and by other parents or family members. And so that role became a profession in the 80s, and there were two primary doula training organizations, and that was focused on birth labor support and not the role of a postpartum doula at that time. And so, but when I had kids, I didn't know what birth or postpartum doulas were when I had my daughter. She's 13 now. But with my son, who is going to be 12, I hired doulas, knew what they were by then, and it was becoming more known. So after I had Seth, I started teaching childbirth classes because I wanted to make an impact on families and have that type of support that I had with my doulas. And then my students wanted me to be their doula. So I decided to take a training, and as a hobby, I certainly just figured I'd take a client here or there. And then it became this passion, and I realized that we needed much more support in my area of West Michigan. And so I created the agency that I wish existed for me with both of my kids. So doulas are certainly becoming more known now, especially because many self-funded insurance benefits now cover doulas. Medicaid covers doulas in many states now, including Michigan. So that is growing. It's becoming more accessible. In the last several years, health savings and flex spending have paid for doulas. There's a military benefit through TRICARE, and some Christian health sharing programs allow a certain dollar amount for birth doula support. So that has made it more accessible to families. And I feel like doulas are in the media a lot more with, unfortunately, we're dealing with a maternal health crisis right now. So doulas are part of the work in the needed support for families, not only in pregnancy, but immediately after delivery.
What were those things that you noticed when you were going through your birthing process that inspired you to open your practice? You had mentioned that there were certain things that you wish that you would have had. What were those things?
I wish I would have had someone there in person. I I worked in politics before having kids and was busy working on a governor's race. It was a fundraiser. And so I did a lot of travel and took a Lamaze class, had switched providers when I didn't feel I had the right kind of support, and ended up working with nurse midwives within the hospital system. And so I felt like I had to do a lot of education. I had kids late in life. And so my friends had kids quite some time before, and the information they were giving me was a bit outdated. So I wished that I would have had someone there in person to support myself and my husband, because I had preeclampsia at 37 weeks, was on bed rest, was induced. So I had done all of this planning to have an in-hospital unmedicated birth. And then all of the sudden, at 39 weeks, I needed to be induced. Things were not working out the way I had planned. And so my Lamaze instructor was nice enough to, take my phone call while I was, getting induced and in the hospital, and gave me some tips. But I really could have used that hands-on support. And then my daughter was in the NICU for 4 days due to some minor glucose issues. So feeding, I'd taken a breastfeeding class and prepared to breastfeed. But because she was in the NICU, I had to pump, and she was, given an IV, enhanced formula. I had 10 minutes in the NICU to feed her eventually when that was a possibility. And so I brought her home from the NICU and wanted to breastfeed, and brought in an IBCLC lactation consultant to help, went back to the hospital for support groups. And I could have certainly used a postpartum doula. There weren't very many in my area at the time, and I didn't know about them. So, yeah, it was overwhelming and not at all what I envisioned. So, through my personal journey with preeclampsia and having a NICU baby, I became passionate about, again, giving families that support and reducing the overwhelm and anxiety that the unpredictability of birth and early parenting can bring.
I think you hit a really good point there, the anxiety behind birth. And, we come into this situation where we have, especially as a first time parent, we have this plan. We think it's going to go the way that we want. We present it to our provider, but anything could happen during birth. And I think there's a lot of fear that's associated with that, and a lot of anxiety. So what are some common concerns or fears that your clients have before birth? And as a doula, how do you address these so that we are trying to have this more holistic, supportive view of birthing?
Yes, great question, Stephanie. So, the biggest fear is certainly having an emergency cesarean and not having their partner there, losing the baby, or, certainly, potentially dying themselves with some of the stories that you read in the media. Especially for Black women, there's a lot of fear of dying in childbirth. And so those are the biggest concerns. And my co-author, Alyssa Veneclaus, and former business partner, we created a course called Becoming a Mother in the Early Pandemic, when clients couldn't have in-person support. Our classes had to move virtual. Fortunately for us, our governor considered doulas essential, so we only stayed home for about 4 days, and we're back working in the hospitals. but still, there were restrictions on visitors at that time. And we did surveys with our live launches for the course, and that eventually became the content for our book. And when polled, women, not only in our client group, but also in mom groups throughout Facebook and the internet, gave us feedback that they had a fear of their relationship changing after delivering, their partner seeing the delivery. Pooping during labor has been a fear. And, just things going wrong. Again, having a baby in the NICU, having the lack of control and the preparation that they did, things just, the interventions that cascade. If you get Pitocin, then it may lead to another intervention, which could end up with a surgical birth. And you had mentioned your own journey of things that you can't really control, like a breech baby. And so, yeah, I mean, having some people have a fear of an epidural, or the needle fear is real, and the fear of having surgery is also real. So at Gold Coast, we teach hypnobirthing, which is very mind body focused, and birth is as mental as it is physical. So that preparation, we have students that know they have a planned cesarean for medical reasons, and they're able to use the visualization, the breath work to, calm their fears that they have. And, the same goes for any type of birth, home, hospital, unmedicated, medicated, using some of the mindfulness and visualization, positive affirmations can make a big difference in overcoming some of the fears. And, also when surveyed, moms were afraid they wouldn't be a good mom, or they wouldn't have support, or again, fear in their relationship changing.
You talk, of course, of this idea of how can we prepare our bodies for birth? How can we, like be comfortable in our bodies, connect with our bodies so that when the time to give birth happens, it's an experience that makes us feel empowered versus an experience that is associated with a lot of trauma, because there are a lot of women that have both of those kinds of experiences and everything in between. And then you move on to, okay, well, after the baby's born, all these things change because your family is different. It's not the same. So can you speak to how, the doula supports the family, supports the partner, supports the mother during the birth preparation as well as after the birth? Can you speak a little
Yes.
bit more on that?
Absolutely, Stephanie. So we support the partner just as much as we do the birthing person. And so encouraging partners to take a childbirth class if that is part of the plan, and a breastfeeding class, because partners can certainly support all types of feeding, including breastfeeding, and having them be engaged in the process. So when I'm at the hospital and a partner doesn't know what to do, they just need some reassurance that, say, this is normal at a particular stage in labor, and they don't need to necessarily fix things, just being there and holding the hand and being emotional support. And for partners who want to take a hands-on support, because many times our role as a birth doula is very physical, very hands-on. We do position changes with our clients, hip squeezes, counter pressure, labor massage, and we can demonstrate some of those techniques to the partners. And I teach an in-person comfort measures for labor class that, some of my families do not have a doula. And so I'm able to demonstrate some of those hands-on techniques to partners so they're able to feel like they can better support their partner.
I love that. I think that in order to really have a great connection during birth and to have the birthing person feel supportive, there does have to be, if there is a partner involved in the process, that partner being involved in the process most of the time makes that experience a lot more pleasant. And it empowers, I mean, it's one of your first steps in working together as a team, because now you are working together as a team to take care of this baby. And you've already started that process within the birthing process. So I love that. Talk a little bit about why are doulas important in the healthcare team? I mean, we know that OBGYNs can be a part of it, midwives, you talked about pelvic floor physical therapists. Why should people have doulas as a part of their healthcare team?
So, you know how busy it is in the healthcare system as a physical therapist. There's limited time for support. Doulas are there to, again, reassure you, give evidence-based information, give resources in the community. So we are that missing link in not only pregnancy support, labor support, but also in that postnatal recovery time. And a nurse may be amazing, but she's responsible for other patients. She has a lot of charting and medical work to do. So that nurse cannot be the hands-on support as much as they'd like to, or the emotional support. And there may be a shift change. So if you have a connection with your nurse and then a new nurse comes on, then that can interrupt the flow of the birth. But a doula, unless they're a hospital doula, that just has no relationship with the client and is there working their shift, then a birth doula hired by the client has this relationship throughout pregnancy, knows how to support the client, knows what the client wants, understands the birth plan. And so when I meet a nurse, I'm able to talk about some of the goals and help the client ask questions if it's not an emergency. So again, we don't take that medical role, but we support in that information, in the emotional hand-holding coaching role, and in the physical support, the way that many nurses wish they could do. And then the provider may have multiple clients delivering at the same time, patients, I should say, actually, and they are popping in and out, but they're not able to offer the continuous support that a doula is. And there's so much evidence for doulas and showing that the continuous support during labor can increase satisfaction and decrease interventions, regardless of the outcome of the birth. So even if the birth did not go as planned, having that support makes all the difference.
And there's so many things that happen during labor and delivery where at some point, you as a person that's delivering the baby, you're not going to be thinking 100% straight. And just having that person say like, oh, well, maybe you should try changing the position you're in, like that may help you. Or, being the person there that can talk to the medical team when you are just trying to focus on delivering that baby. And that's one less responsibility that you as the birthing person have to take on so that you can really be at peace. I hired a doula for my one of my births, and there were things that she suggested that I didn't even know I had the option of even asking for that. And I think just having somebody tell me like, you can ask for that, and also having somebody there to kind of push for the things that I wanted, because society, as a female in society, you want to be polite, and you want to you don't want to be and as a healthcare provider, right? You don't want to be a difficult patient. And so, having somebody there to just really cheer you on, push for the things that you actually want. I mean, that can really, I think, it made a big difference in my birthing experience, even though it didn't go exactly the way that I had hoped. I left that experience feeling positive about it and feeling really happy about the experience that I had.
And that's all we want as doulas, honestly, is
Yeah.
for you to feel like birth didn't happen to you, that you were able to make informed choices and knew all of your options and had the information. We understand, like you mentioned, tools to ask for. like how to get the hot packs and, peanut balls and birthing stools and all of the tools that a particular hospital may have, or getting the client into water, a bath or shower, if that is something that the hospital offers.
Well, and I think even so as we're doing this interview, for those of you that can't see us, I'm drinking a big bottle of water. And this water bottle that I'm drinking out of was given to me by my doula. And one of the things that she told me is she's like, I'm giving you this water bottle. And as you are breastfeeding, you need to make sure that you are, it has, the check marks on it as to how much you've drunk in an hour. You need to make sure that every hour you're drinking this much water because, and then she, of course, like educated me on some difficulties I'd been having with breastfeeding and just having that extra person there to just remind you of those things when, postpartum brain, pregnancy brain, those are real issues that have been medically like shown in the literature that they happen. And
Right.
so there are things that you forget and you just don't remember. Even if you have all this knowledge as a healthcare provider, sometimes it's just nice to have that person there to remind you of the simple things like, are you drinking enough water?
Are you snacking, especially for breastfeeding moms, as you said? Like, it's not just getting those 3 meals in, but you need to restore the depletion that you had from delivering. And then also, think about wanting a good, healthy supply. And so, what that requires drinking a lot of water and having snacks, healthy snacks, right? That are like very easy to grab with one hand. And doulas who are working, in that postpartum phase are able to do some light meal preparation, pick up around the house, clean and bottle parts, and make sure that you're remembering to eat, because I know I forgot to eat many times.
Oh yeah, I think that that's the story of every mother of a newborn's life. And then when you do decide to eat, your baby wants to eat too. So then you're like trying to feed the baby and trying to eat at the same time.
Yes, it's
And
like this continuous cycle.
yep.
Diaper changes, naps, feeding. So never
Well,
ending.
when you guys are in the thick of things, how do you collaborate with other healthcare providers that are a part of the medical team? Can you maybe share a couple of stories or examples of how you or some of your employees have collaborated with other healthcare providers to really make sure that a birthing person is having a great experience?
Yes, so great question. Of course, again, during the labor itself, working with the provider and the nurse as a team, and during pushing, we can help with, for those clients that want directed pushing or maybe have an epidural, we might help count or, help hold them in a particular position that they're delivering in. So that part of teamwork. But I think the biggest thing is, again, resources and referrals. So if I have a client that has a problem with her hip before pregnancy, then I'm going to talk about having her go into a physical therapist and get exercises and get that support during pregnancy. And then if there are any issues with the newborn, like say a suspected tongue tie or any referral that needs to be made to a medical team, then, like I mentioned, pelvic floor physical therapy after. And I work with a lot of athletes who want to be able to, get back to the shape they were in, get back to running marathons, et cetera. So getting a plan for them helps them feel like they have some control in getting their physical goals met once their provider releases them to begin light exercise. So again, if there's discomfort, I'm referring out. If there's potentially an issue with feeding, then giving those referrals. And I'm certainly in contact with the different health and wellness professionals in my area and want to keep up with the latest evidence-based information on, again, giving the best resources. If baby is breech in pregnancy, like maybe looking into an acupuncturist or a Webster certified chiropractor or doing some body balancing to see if baby is able to flip. Or, certainly, connecting with a provider to see about having an external version or something like that done.
Yeah, I mean, the physical aspects of birth, it's always good to have somebody in your corner that can make those referrals. You had talked a little bit about some of the emotional, the feelings that you go through during pregnancy and postpartum. What kind of, tell us, can you maybe delve into that a little bit more? Because I feel like, especially after you have that baby, that first month is especially tough for
Right.
especially new parents who haven't had any kids before. How do you as a doula, you talk about offloading, of course, some of the other tasks, but what types of emotional support do you offer to clients? And maybe can you give some personal examples of times that somebody has been feeling really overwhelmed and you being there has really helped maybe get rid of some of the anxieties that they have, or help with maybe some of those postpartum blues that they're feeling?
Yes. So certainly, I haven't done postpartum work. I'm still an active birth doula and educator, but I haven't done postpartum work in a couple of years due to running a busy agency. But when I used to work in clients' homes, certainly I would say the biggest emotional support is the conflict that new parents and seasoned parents face after, there's so much focus in pregnancy on the mother and the belly and the pregnancy being celebrated with showers and sprinkles. And then when you have your baby, it's all about the baby. Everyone wants to hold the baby. The gifts are for the baby. So the mother feels like they don't matter sometimes, or that, it's their needs emotionally aren't being met. And it is difficult for them to communicate their needs, especially if they are a helper personality and they want to entertain others and make others feel comfortable. So I find that postpartum clients often have those struggles of like family members coming in and it being more work and exhaustion for them to entertain, or people wanting to give gifts for the baby, hold the baby, but they need, if they don't have a postpartum doula, someone to unload the dishwasher, someone to get their other kids snacks, someone to listen to them about how their day is going. I know my husband had to go back to work, and so I was alone with two kids and, trying to, it was isolating not having anyone, an adult to talk to. So even sometimes just processing some of that or coming up with a plan for how friends and family can support you and asking for help during pregnancy versus waiting until you're exhausted and you're leaking and you don't know how to ask for what you want, and then you feel isolated and alone, and that you're just a mom and your former identity is missing.
I think that's a great point, is again preparing for what might happen. Even if you don't have a postpartum doula, having your birthing doula set the stage for that expectation. I think about, like, I remember when my former employer, before I moved, we sat down and he asked me, what's your after birth plan as far as coming back to work? Are you planning on coming back full time? And I was, was like, of course I am. Like, why wouldn't I? And then
Right.
after I had my baby and I came back from maternity leave and came back full time, I realized why he asked me that question, because it was really a lot to handle working full time and also taking care of a baby full time. And I wish I would have had somebody maybe more gently bring up those two conflicting factors that could happen, and that it is okay to adjust your life as you need to, and understanding that your life isn't going to be the same as before you had your child.
Absolutely. It isn't, no matter how we prepare. And as you mentioned, that balance of going back to work full time, having a child. And right now, we're in a childcare crisis. So it can be very challenging to not only find care, and I tell clients that one of the first calls they need to make is to a daycare center, a childcare center, or look for a nanny because it's hard to find nannies at this point. And so, making some of those decisions and what your family goals are, what your career goals are, a doula can be part of that support as well.
That's really cool. Speaking of careers, you had this experience in birth, and you decided to open your own practice and company so that you could offer the services that you wanted during your time. What advice would you give to somebody who's interested in either becoming a doula, or start, if they already are a doula, starting their own doula service so that they can offer the type of services that maybe their current company can't offer?
Yes. So, certainly I would start small like I did and not, build this big agency. When I was a doula initially, I was in a collective, then went on my own. And I had the time as a solo doula to connect with, have coffee pop into physical therapist offices and meet with mental health professionals, midwives, other childbirth educators, and develop these strong relationships before I started my agency. And so I already had people who trusted me as a solo doula and were referring to me. So when I started the agency, I certainly had to invest in a website and marketing and SEO and all of the things, but I already had clientele, and my former business partner brought in clientele as well. She was an educator and a doula, and so we were able to start a bit scrappy and grow the business versus someone wanting things to be perfect and launch it with, we didn't have to seek capital, for example, other than a small like family loan to be able to start. So I say, start small and build. And my dream was to have a large agency, be the first agency in my area, and to offer comprehensive support, not only in our area, but with a lot of the virtual programs we have, like sleep consulting, up to age 5, and the book and the online Becoming a Mother course that anyone anywhere in the world can access.
How did you connect with those other experts and bring them into your practice?
So once I started Gold Coast, I already had a relationship with our IBCLC, and when my former business partner was teaching hypnobirthing, so we brought that to the table, and then just kept adding trainings. When I started Gold Coast, we brought the first postpartum training to our area, because back when I started, I was trained in birth in Florida. I went to Chicago for my second birth training. There weren't a lot of doula trainings in West Michigan, so we brought a trainer. And our original team started after, for the postpartum end of the business, after that training that we brought to our area. And then we added other practitioners, like a meal delivery service for postpartum moms. I no longer have that service. And when I started Gold Coast, we had a placenta encapsulator, which I no longer offer, but just adapting to what our clients at the time wanted versus what our families want now, and listening and seeking out collaborative relationships and recruiting people who may already be a doula or who want to be a doula, and giving them resources on the training options for them. And because I don't train doulas. They need to go through a training organization, get certified, and come back to me.
What does the training look like to become a doula? What are the requirements?
It all varies on the training organization since there isn't licensure for doulas the way that there would be for, say, an IBCLC lactation consultant has licensure. So certainly it can vary. Most doula trainings average 2 to 4 days for the basic training with certification that can take up to 2 years, and add-on requirements like completing a breastfeeding class, and auditing a comprehensive childbirth class is part of that. Some doula training organizations, like the one I went through, require taking a business class, and CPR, first aid, and other add-on requirements. So some trainings could be quicker and some could take long. And then there are other training organizations that are self-paced and virtual that may take a year or two to complete. But most of the time, it's a 2 to 4 day in person. And I personally took my own trainings in person and find a lot of benefit of that, especially because it's very hands-on with the work that we do. So you can only learn so much from a video.
It sounds like your business has kind of changed as it's grown. So, what challenges have you faced as an entrepreneur in this field, and how have you overcome them?
Great question. There's never enough time in the day, and I want to be as responsive to the demand in my community, but sometimes we're booked out and I have to turn people away, and I can only grow so big and run the business myself. So I have a lot of experts that I bring on to my business, like a bookkeeper, an accountant, an SEO agency that I work with, and a marketing VA who also handles my social media. So I sit in my zone of excellence and focus on talking to clients. Every client talks to me by phone, and I personally email them. I choose to not have a VA for some of those tasks, but I also hire out in other areas. So my time is spent on not only the areas of the business that I love most, but that I am also most talented in.
I'm sure that over time, I feel like that's always the hardest lesson to learn as a business owner is figuring out what you should be doing and what you don't need to be doing. It's
Right.
always a big balance.
100%, Stephanie. And as business owners, I mean, things come up, and sometimes a doula gets sick and I need to get a shift covered that night. So I could be at my son's sporting event and I'm trying to get things covered, or I can never fully be on vacation as a sole owner because things crop up that you don't expect. But I also, my family understands and is supportive, and I try to take intentional time off, being on call, and try to delegate when appropriate.
That's really good advice. Well, if you were to go back and talk to your 20-year-old self or 24-year-old self, what piece of advice would you tell that person?
About business or about childbirth?
Whatever you want. If you could give yourself one piece of advice as a 24-year-old person in all these things that you've learned over the years, being a doula, growing your company, what would it be?
I think it boils down to the fact that collaboration is everything. We are not competing even with other doulas, or in your case, physical therapists. There are ways that we can align, and there is ample work. So having an abundance mindset versus a fear of competition, to me, is the biggest game changer in my business.
I would totally agree with that. I feel like when you can get over the fact that, I mean, there's always going to be people that are going to need help. And
Yes.
it's understanding the market that you're in, understanding who your ideal customer is, and then getting out of that, like you said, that fear of competition mindset and into that growth mindset. Because ultimately, when you're a healthcare provider or when you're providing a service like you are with a doula, supporting people through this major life change, you have to be collaborating with others because you alone are not going to be the one that's going to fix everything.
Right. And sometimes someone is a better fit than my agency is. So I'm going to refer appropriately and they will refer back to me.
I love that. Well, Kristin, I really appreciate your time today speaking to us. If anybody wants to get a hold of you, what would be a good place that they could reach out, whether it be social media or email?
Excellent. So our website, goldcoastdoulas.com, is a great place to connect. My email is info@goldcoastdoulas.com. We can be found on Instagram, Facebook, Pinterest, all the channels at Gold Coast Doulas. And for the book, Supported Your Guide to Birth and Baby, that would be supportedbook.com.
And we'll make sure to include all those links in the show notes. And I hope that you guys all live healthy, wealthy, and smart. Thanks for joining us.